Hi, welcome to Tea Time with Lorna. We're back again. We're drinking tea. I'm so happy to be here. This is where I like to be, drinking tea with friends, family, people I meet along life's highway. Not sure what you did for this weekend, but I had a fabulous time, was out with friends. Of course, I drank more tea. I mean, I can never drink enough tea. Today, I have a very special friend with me that I hadn't seen for a while, but I ran into him maybe 2 weeks ago, and he agreed to come on my show. I'm really into health, fitness, and medical, so it's always good when I can have tea with a friend, a fellow Brit, and also a doctor. So that made my day when he agreed. So I'm going to call him Dr. Joe. That's how we were going to address him today. So I'm glad you could be on my show.
Thank
Welcome.
you, sweetie. Thank you.
Welcome.
Oh, we get a hug. I like hugging.
Yeah, there's hugs.
Hugging is free. Let's do that.
So welcome to Tea Time with Lorna.
Thank you, thank you. Well,
So-
I'm excited about my tea.
The first question always is for everyone, what tea did you decide to drink and why?
I decided to pick a refreshing mint tea that is an invigorating and herbal infusion of peppermint, spearmint, and some tarragon. I don't know what tarragon is, but that's not the reason I picked it. I picked it
Okay.
because there are actually some health benefits to
Okay.
peppermint. It's actually has properties that stimulate, and so if I'm going to go home and I'm doing a 35-minute drive so that I am not going to be tired, it is useful to have something that's slightly stimulating, but it's not caffeinated because that will keep me awake at night. So a peppermint tea in the afternoon would be exactly what you need.
Perfect.
Yeah.
I also picked the same tea.
Can I drink it now? Can I drink it?
Yeah, please drink.
There you go.
But I picked it because I just like the colour green, and the label's green. So not quite the same.
There we
reason
go.
as you.
And I like the colour green too.
I said to myself, it's green. I like green, so I picked it. That's why I picked that one. But I kind of like your answer a little bit.
Yes.
Anyway, so let's enjoy our tea and chat. So tell me, obviously as a fellow Brit, I'll start with that question. What brought you to America? Like really, why did you move here?
Well, that is an interesting question. I moved originally to Florida with my ex-wife, who we were living in Israel because my family moved to Israel many years ago from England, so I moved to Israel too. And I had been in Israel for quite a while, and my ex-wife, who is an American Israeli, wanted to come to the States because she had been in America and she wanted to come back. And so I had to redo all my training again because I'd done training in England, I'd training in Israel. So in the States, physicians who are international medical graduates have to do their training. So I did all my training again, which was up here and also in Arizona, and got recertified. It was fun.
I think that's when you and I first met, when you were here and you were finishing your training.
That's right.
I think
Well,
that's
before my
when
fellowship, but yeah.
Yeah. But I didn't know you were already trained in 2 other countries.
It was a long-winded way. Let's just put that.
Yeah. The advantage is, though, you can go at any time.
Actually, you know what the real advantage is? The real advantage is that there is a body of information that you really do need to be familiar with as a physician, because there's some basic just stuff you need to know instinctively, and the more you review it, the more it becomes second nature because it's used in clinical practice and is practical. So the fact that you have to take your boards in England, then in Israel, then again in America, it's the same information because it's the human body, regardless of the accent or the location. And it's actually quite useful to review it a number of times because it makes you more familiar with everything.
The funny thing is, when I was in England, I was teaching aerobics for a while, and I had to take anatomy and physiology in England. And there were another class I had to take, I don't remember right now. And when I moved here, they were like, oh no, you have to do it again. And I'm like, the body is the same.
That's right,
it's
exactly.
The same body
exactly.
in England as it is in America.
That's all
Why
true.
do I need to do anatomy and physiology? And they just went crazy saying you had to. And I'm like, trust me, the patella is in the same place on me as it is in everybody else all over the world. I didn't understand
Unless it's dislocated, absolutely
Yes.
right. Yes.
Well, yeah, of course.
There we go. Then
that's
a
then
problem.
it could be anywhere.
Absolutely.
But I was so upset. It was to the point where they were like, well, if you could prove that you've taken it, get copies of the course schedule and send it to us along with other things from the class. And what you know, with the time change and the time difference, who was going to answer the phone when I was available?
No, I agree. It was impractical.
Yeah,
You have to do it again.
I just redid it again.
You have to do it again.
So
I didn't get any credit for anything I might have done. It was just seen as interesting, and you had to do everything from the beginning, which was fine. I mean, you know, just the same as lots of. I was working with someone yesterday. I was in another hospital doing some work. He was a neurosurgeon in another country, and now he's working as an attending hospitalist. And so it was actually quite amusing, because we were looking at a CAT scan, and he literally knows all about CAT scans because he puts drills in human brains. So again, he had to do all the training from the beginning. They didn't give him a pass because he'd been a neurosurgeon. He just had to do it all again. That's okay. Makes us trained more.
Yeah. I knew someone actually when I was working in Stanford Hospital in the Maine who was a dentist. He was an oral specialist. Yeah. And when he came back, he chose not to do that and got a job as a dental assistant. Because he's like, I just don't want to do it. I don't. So he worked as a dental assistant for a few years until eventually he said, I just can't do this. Right. And he retrained. Yeah, but I felt bad for him because he was an oral surgeon.
It's long. It's long.
Yeah. But, amen, it is what it is. They have standards, and that's what it is. So, okay, so you're here.
Uh-huh.
Now, I know that you have a background in Western medicine, obviously, and Eastern medicine.
Yep.
So how'd you go from America to that type of medicine?
Well, so my training it's not just Eastern medicine, it's integrated medicine, which means you're using alternative and complementary approaches from around the world. So it's not just Eastern, though a lot of what we do is Eastern because we do a fair amount of acupuncture, but we will use botanicals, which are herbal remedies from all over the world, and they won't just be from Asia. They might be from India or a rich European tradition of botanicals. So we use those. I do hypnosis. We teach guided imagery and meditation. And then one of the fundamentals is nutrition. So that's probably the thing I do more of than anything else, is literally seeing patients who have specific medical conditions and treating them purely through diet. There's no drugs because we don't use any
for the medical condition.
So as I was going to say, it's disease specific and it's person specific. So everybody doesn't get the same plan because it depends what your issue is and it depends who you are and what you are going to be able to go with. That's the elegance.
Because didn't you train at some point with, is it Andrew Wells who's out in Arizona?
Andrew Weil, yeah, yes, that was where I did my fellowship, yeah.
Yes.
So after training in a primary care specialty, I did family medicine. After doing that, I did a fellowship in integrated medicine, and then for the last 11, 12 years, I've been working as a consultant in integrated medicine.
Wow.
Yeah.
That's impressive.
It is what it is.
Well, that's...
Pays the bills. No, it's awesome. It's very awesome. It's very awesome.
That's amazing, because I did know that you were in Arizona.
Oh.
And because you mentioned it, I just put two and two together and said, wait, I remember you telling me that once.
It was hot.
Yes,
it's a beautiful state.
Hot. I liked Arizona.
Yeah, beautiful state.
I was very surprised at how much I liked it.
Yeah, no, it's beautiful.
Went over to the Grand Canyon. Had a great time.
Yes.
Decided, I'll tell you a funny story. I was in New Mexico with my sister. We decided that, we were always going to the Grand Canyon, but I wanted to be there for sunrise. Who does that?
Right.
And we had to drive all night, and I really mean all night, to arrive at the Grand Canyon for sunrise at 6 a.m.
Which you did.
We did.
Which is great.
It was amazing.
Yeah.
It really was spectacular.
Wonderful.
And I thought, when am I going to do this again? So it was
That's great.
Really, really
that's a beautiful.
amazing.
That's beautiful.
I loved it.
That's communing with nature.
Yes, it is.
You see yourself in a larger picture, and that's also it actually impacts on your health.
Yeah, it was. I was pretty impressed. Of course, we were the only two people there.
Right.
Nobody else was up at 6:14.
That's right.
Because that's what time it was.
That's
in the middle of the Grand Canyon. We were alone.
That's right.
So
you and the coyotes, exactly.
Yeah.
Yes.
And the rattlesnakes, which
that's
I
right.
had forgotten to give thought to on my drive.
Right.
I was so busy with singular focus,
right.
This will be great. As my sister's like, I think this is a bad idea.
Yes.
But since I was driving, what
right.
choice did she have? Anyway, well, that sounds like a great experience.
Yeah.
That sounds great. So what do you find that patients come in here, what are they really looking for when they come in to see you? What are they looking for? Other than, I don't know, cure or miracle? I don't know. What are they looking for?
I think most of the time the patients are frustrated with their current medical plan, which is mostly pharmaceutical. So they're on more and more medicine. So one of the jobs I do from time to time is I will do some work in another hospital, and there I'm not doing any integrated medicine, I'm just admitting patients to the hospital, and the older you are, the more medicine you have, which is what I see in America, and it just goes, and so by the time you're 80, the medication list is 15 or 20 things, and just purely from a factual point of view, when you have over a certain amount of medications, you're going to start getting interactions. You're going to start getting issues by taking one medicine with the other, and sometimes you have to take a third medicine to deal with the complications of taking the other two. So it just all gets a little out of control, and it doesn't mean that there's anything wrong with prescription medications, because they are wonderful and they've revolutionized medicine. So we're not 200 years ago where all we're doing is grounding herbs, but at the same time, just because we have medication, there are other things that you can do that are integrated into that system. So the patients are coming because they don't want to take a medication, they're taking medications that's not working, or they simply just, the whole plan is not working, and so they need a completely different perspective, which is the part that most of my physician colleagues are not so in tune with or looking at, which is their lifestyle, which is how you eat and how you sleep, and how you deal with stress and how you move, and all of those components. Almost every single medical condition will in some way improve, and a lot of the time significantly, if you work on those components. So you look at somebody's lifestyle and you look at their nutrition and you say, all right, what actual disease do you have? Because are you eating correct for your disease? Because the diets are totally different depending upon, is this going to be a low-carb diet? Is this going to be is it a protein issue? Is it a fat issue? So there's an elegance to nutrition that most people aren't aware of and just go on their fad diet, but they're not sure quite what they're doing. But it turns out there isn't one diet. There's lots of diets, and they're all for different medical conditions. And the point is to make that understanding, and then you also have to have an understanding of where the patient is and what they're likely to be able to tolerate. So you can't make everybody fast, and you can't make everybody a vegan, but you can help with people where they are with a certain plan. And it isn't just about everybody should eat vegetables, because that's obvious, except for it's not true, because there are diets that actually, there are certain vegetables that really would be a problem. That's the whole point of the exercise.
Do you find, I think I read somewhere, and don't quote me because maybe I'm wrong, that
you've never been wrong, ever, in a life. It simply has not occurred.
That I heard that cauliflower interacts with some drugs. Is that true?
So what I can say, I don't know interaction with some drugs. Actually, cauliflower has a component. It's an interesting thing. Okay. Cauliflower has a component. It is part of the cruciferous vegetable family.
Yes.
The word cruciferous comes from the Latin word for crucifix, like a cross, because the flower in all of these vegetables is like a cross, and that's what distinguishes them from other vegetables. Cauliflower has, as part of that family, have some interesting compounds, and one of them is a thing called sulforaphane, which seems to have an effect on detoxifying. No, it's detoxifying, helping with the estrogen metabolism. The body has estrogen, especially obviously ladies have estrogen, and when the estrogen is metabolized, it can be metabolized into a more or a less cancer-forming byproduct. So they have, it's called carcinogenic, and you can have one type of estrogen that's metabolized that's actually more likely to cause abnormal cell growth, and one that's less. And so one of the things in the cruciferous vegetables are these things called indole 3 carbonyls and sulforaphane, and they seem to have an effect on pushing this into the less carcinogenic, healthier pathway. So it's actually better. So all my patients with breast cancer are always put on masses or a lot of foods of cruciferous vegetables.
So your cauliflowers, your broccolis,
chard, Brussels sprouts, all of those. Now the issue is, so that's a cancer problem. But what happens if you have irritable bowel? So if you have irritable bowel and you tend to bloat, That is honestly what that is. It's a food that is high in these things called FODMAPs, and they are essentially the food that ferments by bacteria in our intestine. And if you're bloating, it's because you're fermenting and making gas. And the worst food to eat is
cheese.
Cruciferous vegetables, because you will bloat. So you see, that's the point, is that you can't just eat everything, and everyone doesn't eat everything.
Okay. But can I still eat chicken?
You can certainly eat chicken, unless...
Oh dear.
Yeah, it depends what the problem is.
Please don't upset me.
No, it depends what problem you have. So, for example, if you're going for a more plant-based, then there's some issues with animal protein.
Okay.
It depends on the problem you have.
Okay, I have a problem if I don't eat chicken.
There we go. Then that might be a problem. No, it's fine. Chicken, I'm sure, for the right person, chicken is fine. Chicken is fine. That's good. That's good.
I'm messing with you because that's really interesting. Looks like I'll be making an appointment when we finish.
Yeah, and then I'll feed you chicken.
You say that now, but wait till we have the consultation.
That's right. Yeah, well, that's probably true. That's probably true.
So I may need to be on the occasional chicken diet.
I have chickens at home.
Oh,
that are alive, yeah.
Oh, you raise
chickens and ducks. Well, apparently every time I come home, my wife has got new animals. So this week was ducks, and about 2 weeks ago was chickens.
Do you live on a farm?
No, but apparently I do now. So we have, 2 bunnies and 4 chickens and 4 ducks and 5 dogs and a cat.
That is a farm.
It could be. It could be. I just want, and I'm saying this to the world and to the internet, that as long as I don't have a goat in my bed, I will consider myself lucky. Because there was a chance that my wife was going to bring a goat back from Greece and I was going to end up with a goat.
Wait, why would she we don't have goats in America? Why was she bringing a goat from
So it was actually quite a cute story. My wife was she worked in emergency medical services, and she volunteered for a number of years to go to help with the Syrian refugees who were coming across into Greece, and so she went and helped them for 2 weeks. And she won an award, and she was on Fox News. It was very nice. While she was there, she fell in love with a Greek goat called George. And the Greek goat called George had no ears because he had some kind of congenital malformation, and she spent 2 weeks looking after all of these people. It was pretty harrowing and dramatic, but at the same time trying to persuade some consular that she could bring George the Greek goat back, and we would have George the Greek goat, who would obviously be living in my bed. It's not even in my house, it's in the bed. So it didn't happen, I hasten to add. Unfortunately, George passed away because there was something wrong with him, and she was very sad.
I'm sorry.
And it was a sad story, the sad story of George the Greek goat. But I do hold myself slightly lucky because I was very close to having other animals into my bed in my house.
Is your wife American?
Yes.
She doesn't know the rules. We don't need that many animals.
Oh, I know we have
One
lots
or
more.
two.
I know, no, it's all wildness.
Yeah. No.
And then I got to tell you about the ugly dog. So I thought that we would stop. No, it's good. The ugly dog. The ugly dog story goes like this. So I was obviously concerned that what we have is this general tendency to adopt animals. So I thought I'm going to play this cool. I am going to tell her that we can't adopt any more animals until I have my ugly dog, which I thought was going to work. So then...
But were you really going to get a dog?
I would have got... No, we have 5 dogs anyway, but I was going to get a dog that was ugly. The reason why it was ugly was, firstly, I had to decide it was ugly, and I don't think things are ugly in general. And secondly, I wanted an ugly dog because ugly dogs basically never get adopted and then they just get put down. So I'm not going to have a beautiful thing. I'm going to have the ugliest thing ever.
Okay.
And I thought that would delay her. That was a delaying tactic. It did not work.
Because she
found, like within 2 days, she found this thing that was quite hideous. And so then she said, let's go get it. And so I said, all right, well, I got to, and then the question is who's going to walk it, etc., etc. So we're now in negotiations about ugly dog, but she's still got her chickens already.
So where's the dog now?
I don't know, but we're working on that.
Okay.
We're working on that. But I believe my birthday's coming up, that I may have an ugly dog coming my way. That's right.
Listen.
I know.
Listen, perhaps you should tell her you're wife number 2.
There we go.
That's
exactly. That's right.
There was a wife number 1. That's all I'm saying.
That's right.
You just leave it like that.
This is my keeper wife. This is my keeper wife.
Okay then.
This is my keeper wife.
I don't know what you should do, but
no, I'm going to take my ugly dog. It's going to be ugly, and I'm going to call him something beautiful.
Okay.
And I'm going to make him think he's the most beautiful dog in the world.
That's so funny.
It is.
Yeah, that's pretty
part
funny.
Of my life. Part of my life.
That's pretty funny. So obviously you're a dog lover and an animal lover.
Can I tell you a funny story?
Oh God, yes.
About my, this is so cute about my daughter.
Another one?
So yeah, no, just about my daughter. It just reminds me. Well, two things. First, I had a patient today, and so she comes in, and then there's this little 3-year-old.
She the
patient, yeah.
Okay.
And this is the mummy, and then the 3-year-old comes in afterwards, and I say, "Oh, you come with a little one," and he looks at me and he goes, "I'm not little," which I thought was so cute. And my daughter. We were watching a movie, and she said to me before we watched it, she said, "Now, Daddy, it might be a little scary." And I said, "Who's it going to be scary for?" She's 6, by the way. "Me or you?" And she said, "Oh, for you, because I have already overcome my fears." And I was like, "Where did you get that?" And that's not true, by the way. That's right.
Oh my God. Well, we all know kids say whatever comes
It's
to mind.
hysterical.
Oh my goodness. I actually work today within the school system because I do some part-time substitute teaching, and I had a little competition with the kids. I put them, and we're of the mindset, we come from England. There's a winner and there's a loser. That's it.
It has to be.
There's a winner and there's a loser. There's your first, second, or third place. That's it.
Right.
Everybody does not get a certificate.
That's right. That's right.
So
That's right.
I told them this is Group A, Group B. That's it. We have this competition, and Group A wins, and one of the kids in Group B goes, "Oh, it's a fix." I was a
Right,
fix.
exactly.
And these were kindergarten kids.
Right.
He's like, "It's a fix. You fixed it. You wanted them to win." And I'm like, "Are you for real? It was a numbers game. It's say your numbers. Where is the fix? You lot didn't get as many right as they did."
That's right.
And he goes, "Well, I want my prize." And I'm like, honey child.
That's right.
You did not win.
That's right.
There is no prize.
That's right.
And he looked at me like,
That's right.
because I lost,
That's
I
right.
don't get a prize.
That's right.
And I was like,
I
didn't even know
you
how
get
to...
the prize of understanding. That's what you get.
I shook hands with them, with the team that didn't win. I didn't call them losers.
Yeah,
because you can't do that.
No, why?
I shook
You don't
hands
need
and
to.
I say, "Today you were not the winner."
That's right.
That's what I said.
That's right.
And one of the kids goes, "Well, this is how life's going to be. This is a mess." I was like,
That's right.
these are little kids. I was like, it's not that serious.
That's right.
It was
That's
just a tiny
There we
game that
go.
I made up on the spot. It was so funny. But anyway, let's get back to medicine for a second.
Sure.
What do you find is the, obviously being from England, what do you find is the difference between the healthcare system in England and here in America? What do you find the biggest change?
I think what surprised me, and I'm going to compare the healthcare system in England and in Israel, both of which places I worked before I came to the States, and is the speed with which things are done here. So in England, firstly, there is a concept of a waiting list. There's also some form of a waiting list in Israel because it is everybody has insurance. In Israel and in England, they're in different insurance companies, but everybody has it's universal insurance. And in England, it's obviously the National Health Service, which is a universal insurance as well. And so there is a limit to what can be done in a certain amount of time. So when my grandmother needed a knee replacement, she had to wait. In England, this was 9 months to get her knee replacement because you were on the list. That's kind of how it goes. And here, that is not how it goes. It's how quickly can we get it done. And your knee replacement, honestly, once the orthopedic surgeon, one of my best friends is an orthopedist, once it's ready to go, and we're just getting it done. I mean, the same thing holds true for if you come into the hospital because something happened. You get in the MRI in like 3 hours, and we're moving. Yeah, it's all done very, very fast.
Quickly, that's true.
And
even sooner sometimes.
And right, it's done. And there's a lot of tests. Right, there's a lot of tests that are done, and a lot of imaging, and things are done very quickly. That's the biggest impression I had was like, wow, this is also fast.
That's true too. I had never looked at it that way. But yeah, having worked in the ER, I have to say it's true. When people come in, it is a matter of what's wrong with them. Let's run these 5 tests or however many needs to be done. And you just go, you just do it. There's no thought process of, we know you're having this issue, and what we're going to do is we're going to send you home with this, and you're going to have to come back in 2 months' time to get the MRI or the CAT scan or whatever done. I never thought of it that way.
Yeah, most of the time things are done.
Yeah.
So and that's okay. I don't mind it. Obviously, the whole place here is extraordinarily expensive, and the healthcare outcomes are not that good considering how much we're spending of our gross domestic product.
Why is that? Why is it if we're able to get a CAT scan in 5 minutes?
Right.
Literally, you know this. We both know this. You walk into the ER.
Yeah.
You got chest pain. We're doing an EKG within minutes.
Yeah.
You know, within seconds sometimes.
Yeah.
And yet we still have so many people dying of these things.
Right.
When is the issue diagnosis? Is it?
I don't think it's diagnosis. I think it's
absolutely.
I would imagine that most of this could be prevented with a significant overhaul in preventative medicine. So if everyone was focused much less on disease management, and so the 10% of the population who were diabetic were being seen by a dietitian or by someone who's competent in nutrition, and we're actually giving it a good college try, I think our outcomes would be completely different. I think we're a very, very sick society because you have 60% of us who are obese or overweight, and that's going to be that's a lot of people.
And that's not the case in the rest of the world.
They have an obesity problem, they have a diabetes problem in the rest of the world, but I think we are still heavier than most other countries. Anecdotally, when I go to Europe and you walk around Europe, the people in Europe are just not as heavy as if you go to Disneyland. Disneyland is America, and you go there and you'll see. Yeah. And so I think that a lot of this is lifestyle. So I think you're starting with a sicker population anyway. And then there's lots of tests, and I think our focus is perhaps too much into disease management with lots of medications and flashing new techniques and flashing new meds, which are great and fantastic, but a lot of this could be prevented much earlier,
much sooner.
And that's what we should be doing.
So maybe
with our kids, no less.
So maybe what we should be doing, and I say we as in this country, is looking more at preventative medicine. In other words, I'm a fan of free health club memberships to people. Free pre-screenings of some of the basics. Like, this is free because we know it affects people after 40. This is free because it affects people after 30. You know, some free stuff
100%.
to get the basics going, and so you have a baseline to start with.
Which they do. The problem with the health club memberships is that it isn't simply having the membership, because as we know from the health clubs, there's probably about 10 or 20% of the people actually really go. So everybody else has a health club that they don't have. It's just a club that they don't go to.
Yeah, that they pay for.
That they pay for, sure. And that's because we need to understand more about their individual lifestyle and what are the barriers to actually doing this and what's motivating them and what we can actually do to move this forward. They have to buy into it. They have to feel, okay,
why are the people in Europe healthier then? What have they bought into that the Americans have not bought into?
I think it probably has to do with quality of food. It has to do with the quantity of food. It has to do with the amount of activity they have. Everything here is driving. There is much more walking. Whenever people, honestly, when they go to other countries, they seem to walk much more than they walk here. And I would say that the portions in Europe are much more reasonable than the portions here, and the quality of the food is probably different.
I have to say, I went to the Czech Republic a couple of years ago, and I had one of those walking a Fitbit or something of that nature.
Yeah.
And one day in the Czech Republic, I walked 25,000 steps.
That's right. That's right.
And that
like
was just
12
one
miles.
day.
That's right.
And this was just sightseeing. This was sightseeing. This was not a sponsored walk of any type.
Right.
It was just basic walking around, looking at the town.
And that seems to be more activity. They're slimmer.
Well,
it's a shame.
I want to thank you for being on the show with me, sharing tea.
Always sharing tea.
And sharing some valuable information. Now I know I should be drinking this mint tea for other reasons other than liking the color of the label.
I think that's exactly right.
Because in time, you know, somebody may make one that's not in a green bag.
That would be disastrous.
That would be a travesty.
That would be.
So now that I know all the additional benefits, I'm adding that to my list. I already liked mint tea, so this just makes me want to drink it even more. So I'm so grateful that you took time of your crazy busy schedule to come and hang out with me and drink tea with me. Yes, because you came to my breast cancer thing a couple of years ago.
I remember.
And I remember you gave a great lecture, and that was great, and they loved you.
Thank you.
So I really appreciate that, and that's all we have time for. And thanks for tuning in to Tea Time with Lorna. Bye.
Thanks so much.